My dad was a good man. It's a hard question. What was he like?
He was a beautiful child. He was easy to talk to, very easy to talk to.
He loved football. He loved Chelsea.
I support Chelsea because of my dad.
Yeah, he was just a brilliant lad. I've got to say that, he was brilliant.
Everybody would say that he was so laid back. So laid back, he was horizontal.
You know, he had a really good sense of humour. We did have a good laugh.
He worked in the construction for just over 30 years.
He was a great guy to work with, to be honest. He was a hell of a team player. He always had time as well.
He was one of the people that I probably aspired to be. So, no, he was key in my career, as well as being a mate.
And I do aspire to be like my dad.
The project he was working on was going into the next stage or phase of the construction.
He just changed his whole attitude. He just wasn't sleeping. He was so ill.
I went back to uni and I said, just keep me up to date. And I thought when I come back for Easter, he's going to be back to himself. And Easter came and it was horrendous.
He started to feel that he couldn't manage the workload.
Because he was in sort of our office at the time, and we sort of talked about it, and
Chris opened up to myself and Frank, and we were quite surprised how his demeanour had changed, and some of the things that he was taking on board, how it was affecting him. It wasn't the Chris we knew.
So I don't think he knew what was going on in his head, and I think he just wanted it to stop.
He just wasn't the same man. He wasn't. He was so stressed, so under pressure, so ill, because he would never have done what he did as the old Chris.
You never think this is going to happen because he's still dad and he's going to get through it, but he couldn't. It's okay.
Can't describe how much I loved him.
He's the only person, the only boy, but the only person probably as well, made me cry. And I cried.
You know, you don't expect to lose a child. It shouldn't happen. There's no description in losing a child. It should never happen.
Nobody saw it come in, really.
it was a shock, difficult to sort of like comprehend and to come to terms with, but real shock. Yeah, such a shame, such a waste.
Other families don't have to go through what we're going through. We'd like to save them from going through it so that mental health or stress within the workplace is dealt with.
With Dad, it was the stress that led him to not sleep. He was so worried, so consumed by the fact that he was going to lose his job, and he was never going to. It was the irrational thoughts that were coming.
If it could happen to Chris, that's the bit that doesn't compute with me. If it could happen to Chris, it could happen to anybody else as well.
If people can sort of understand it can happen to anybody.
If they feel that their workload is making them stressed at work and at home, and they're starting to feel that they can't manage it, please do approach someone.
Just to reach out before it gets too late, because obviously my family's experienced it and it's the worst thing anyone could ever experience.
An awareness or an awareness training will help, and it's much better to reach out to someone and find it was nothing you needed to do.
Companies need to be aware of what is happening, and the stress can kill. Does kill.
Because it was all so sudden, if it can happen to him, it can happen to anyone.
And that's without scaring people. I think it's a really important message, and that's why you should really ask for help. You're not a weak person. You're still the same person. Just need a bit of help along the way, you know?
Well, what a moving way to start this morning's session. Thank you to Michelle Wiles and her friends and family, our patron of Mates in Mind, for sharing that video with us. And good morning to you, viewers, and welcome to the Voice of Authority webinar brought to you today by the London Construction Programme. My name is Toby Fox. I'm the Managing Director at 3Fox, the marketing agency for councils. And our job is to keep our network of councils and developers and investors and their influencers and advisors connected. And one of the ways that we continue to do that is through this online channel, the Voice of Authority, which is a platform for councils to discuss their ambitions and challenges and influences and issues of urgency. And is there anything more urgent than mental health? Our opening video would suggest not. Even before the pandemic, men in the construction industry were 3 times more likely to commit suicide than those in other sectors, according to the Chartered Institute of Building. With the highest rate of suicide of any profession at 700 a year, 1 in 7 construction workers have known a colleague who's taken their own life. A shocking 87% reported anxiety and 70% depression, and COVID-19 only increased those stress levels. Now, this isn't an exclusively male problem, but ONS statistics for construction show 1 woman's suicide for every 140 by men, despite women comprising around 11% of the workforce. And prioritising mental health and well-being in the construction sector will save lives and improve overall safety. As well as the moral and legal imperatives, improving mental health will boost productivity at a time when labour shortages are pressing. While many, if not most, built environment organisations have enhanced well-being measures during the pandemic, how effective have they been? What measures have actually worked? And as pressures on the public sector continue to build, what lessons can be learned client side? Over the next hour, we're going to try and answer 3 specific questions. Firstly, what is the state of mental health in construction and among local authorities, and how are organisations responding? Secondly, how do clients have a responsibility to support and promote mental health, and how can procurement strategies contribute? And thirdly, what strategies and initiatives that have demonstrably improved mental health are available to you and your organisations to apply immediately? And what steps do contractors and clients and frameworks need to take next? To tackle those questions, we've assembled an awesome panel, and it's a real pleasure to introduce to the Voice of Authority today, in alphabetical order, Lisa Bliss, who's Commercial Business Partner at the London Construction Programme, and Paul Hay, who is EHS Training Manager Health and Safety Europe at Lend-Lease. Also Sarah Meek, who's the Managing Director of Mates in Mind, and Stephen Stanbury, who's the Managing Director at Wellbeing Solutions. Now, make the most of the expertise assembled on your screens, viewers, by firing in your questions through the Q&A function, and we'll address as many of those as we can during the course of the conversation. We welcome your observations in the chat also, and in particular, we'd like to hear from you about any good practice and benefits that you've managed to achieve through initiatives in your own workplace. Let's share those with our panel and with your fellow viewers. But in the meantime, let's get the discussion started by asking our panel for their perspectives on the state of mental health in construction and among local authorities, and how organisations are responding. Sarah, let's start with you, and perhaps you could introduce Mates in Mind as well.
Yes, thanks so much, Toby. So Mates in Mind was established 5 years ago by the Health and Construction Leadership Group, and we predominantly focus around construction, and we support organisations around that really important preventative, proactive piece to support the tertiary measures such as employee assistance programmes and mental health first aiders. But for us, the prevention piece is so important. We get to understand the organisation, evaluate where their gaps might be, tailor training according to the workforce, but more importantly, the management to start those conversations going, support leadership, and And as a charity, we also commission research. Recently, we've had something around the SME, mental health needs of the SME and sole trader population. And we also support apprentices in colleges who are entering the industry to make sure that their mental health is something that, ensures a long time career and something where, they are the business managers and line managers of the future. So it's really important to us, and a focus around, as you saw in the video, around work-related stress, not just the tick box exercise around assessing it, but actually how does that change within an organisation.
And you were formed in response to what? What is the state of mental health in the construction industry?
Yeah, we were formed on the back of the original report, which stated that 2 construction workers every day were unfortunately taking their life, and it very much called out for some proactive approach to this, and we can see from the statistics that 26% of the construction industry are still thinking about taking their life. Those pressures, and particularly through the pandemic, have not gone away. It could be we're seeing higher levels of anxiety at the finishing trades end, the financial flows, the relationships with colleagues, and the workload being very high, and people being having a sense of loss of control of it as well.
And this isn't simply in one sector of the workforce, is it? These are issues that spread right across every part of the workforce.
They really do. Mental health, as we know, doesn't discriminate according to your job role or your age or which part of the sector you work in. We are seeing the middle managers being really pinched on this, but as I say, we're also seeing that the sole traders who are having to go from site to site, learn different ways, different cultures, different ways of support, and so we are seeing pockets of good practice, but it is far from consistent. And as a charity, as an industry, we have an obligation to provide a level of consistency around mental health support, and that schemes where you've got particularly I can speak for the charities' perspective on this. We really encourage the supply chain to be involved in that training, that awareness piece. They shouldn't be excluded from it because it's key that we involve everybody, and everybody's looking out for each other.
Thanks, Sarah. We're going to return to some of those threads later. Paul, Lend-Lease is known for being quite forward-thinking in this area and picking up on it relatively early. Can you tell us a little bit about your role at Lend-Lease and the state of mental health in your workforce?
Yeah, sure, Toby, and good morning, everybody. Yeah, so my name's Paul Hay. My day job is I'm the Health and Safety Training Manager for Lend-Lease Europe. Lend-Lease is a multinational, Australian multinational construction property investment and infrastructure company, but I sort of work in the European business. On top of my sort of day job, I suppose, as a health and safety manager, I also am one of the program leads on our mental health and wellbeing program and strategy. We began our journey back in about 2013 there or thereabouts, and I suppose to sort of put it into some kind of context, I've worked in health and safety now for quite a long time. Makes me feel very old, about 27, 28 years, something like that. And it's fair to say, prior to 2013, my focus as a health and safety manager, and I think I'm not unique here, was very much on physical health and safety, keeping people healthy and safe while at work, and not a lot of thought really was given to mental health and well-being. We began our journey back in 2013, and it was a massive sort of turning point for me personally in terms of recognising that health and safety goes far beyond physical health and safety. Over the course of the last sort of 8-9 years or so, we've had a fairly extensive programme focusing primarily on our own people. I'll talk a bit more about our supply chain partners in a bit more detail in a moment, but focusing primarily on our own people. And our mental health and wellbeing strategy, in essence, has 3 pillars to it, 3 columns to it, those being education, support and promotion. As Sarah sort of talked about briefly there, education personally I feel is massively important in terms of improving attitudes and mindsets and culture around mental health, whether it be something as simplistic as attending a half-day awareness session up to becoming a fully trained mental health first aider and everything else in between. And we have a very extensive educational program around mental health within our business. The support piece is the usual sort of stuff like employee assistance programs. We're also very lucky in that we have access to private healthcare, which I fully accept that not everybody does. But also it includes things like having a significant network of mental health first aiders. Within our business at the moment, we've got around about 200 what we call active mental health first aiders in our business. These are people that have initially gone through the 2-day training program, but then upskilled themselves in other areas around things like self-harm, eating disorders, that kind of stuff as well. And that represents something like around about 1 in 6, 1 in 7 of our workforce, which is pretty good. Mental Health First Aid England's own target is they want to train 1 in 10 of the adult population by a certain period of time, and we're already about 1 in 6 of our workforce. And then the promotion thing can vary from tying into national, international campaigns, running local initiatives on site. We do an awful lot of work with the Lighthouse Club around some of the initiatives that they run as well. And to that point, we also recognise that the bulk of the people that work on our projects don't actually work for Lendlease, their supply chain. And it's great that we do all this wonderful stuff for our own people, but of course we also recognise there are significant problems within our supply chain. So an awful lot of our time, trouble and effort is also focused in that area around those 3 pillars again, around education, around support, and around promotion.
Thanks, Paul. And the figure that Sarah mentioned was, I think it was 26% of people on average in construction are considering taking their own life, which is shocking. It's a difficult question to ask anyone representing a corporation, but how does that resonate with you in terms of your experience at Lendlease? Is the figure similar? Are you aware?
Yeah, I mean, I suppose if you think about the sort of demographics of our business and the kind of organisation that we are, we're very much, I suppose, in simple terms, a management organisation. We don't directly employ, I guess, what we call blue collar workers. They all work for our supply chain, as I'm sure Sarah will back me up on. The lower down the sort of ladder you go, the higher the risk from suicide. So from a personal perspective, Lendlease, look, we of course have issues. I'm not suggesting we don't, but we haven't been directly impacted, to my knowledge, around suicide. However, I am of course massively aware of supply chain partners that have experienced suicide. And one thing I always find quite interesting, challenging maybe, is the fact that, as an organisation, as an industry, we focus massively around capturing data around incidents, accidents, near misses, riddles, to use some health and safety speak and all that kind of good stuff. We're not quite so open in terms of talking about the impact and effects of suicide. In fact, interestingly, last week there was an article that I read where the HSE, and we could debate this why, but the HSE are still reluctant to capture data around things like workplace suicide actually, and mental health. I kind of understand why, because it's far more complex than maybe somebody being injured by falling off something or being struck by something. But I think that possibly, we need to maybe open up the conversation a little bit more and accept, look, whether we like it or not, this is happening, and I'm a genuine believer, and my experience has taught me this, that sometimes we need to get uncomfortable with some stuff to get comfortable with it. No one wants to be talking about this issue, but it's a reality, and we can bury our heads in the sand for as long as we want. It's not going to go away. So we need to confront it face on, I think, and have open, honest conversations about its impact. But look, to my way of thinking, whether someone's killed because of an accident on site or they're killed as a consequence of suicide, it's the same impact, right? The impact on colleagues, on friends, family, etc., is devastating.
Absolutely. Well, I mean, I must admit to feeling very self-conscious about talking about this, but we've got where we are by not talking about it. So I completely agree. We have to take the conversation forward. Stephen, can you tell us a bit about Wellbeing Solutions and the sort of sectors you cover, and how what we've heard so far resonates in those sectors?
Yeah, of course. Good morning, Toby. Good morning, everybody, and thank you for this opportunity to participate in this really important subject. So my name is Stephen Stanbury. I'm the Managing Director and founder of Wellbeing Solutions. We are a provider of EAPs, and to cut through the jargon, that's employee assistance programs, or to distill it further, 24/7 confidential counselling helpline services and other mental health services to around 500 employers. So we work with employers in all shapes and sizes, in all sectors, in all parts of the country, with dozens and dozens of local authorities of all sizes, and also with many organisations in the construction sector. We've been doing this for around 20 years. And of course, the mental health landscape has changed quite dramatically in that period. I mean, it's interesting even to look at the sort of terminology. I think when we started off in this sector, we were all talking about stress. Stress was the word we used to use 20 years ago. Then we used the term kind of wellness or well-being. And now, which is a really positive thing, we are actually talking about mental health. We've kind of evolved. The language of the conversation has evolved. And we're kind of calling a spade, which is a good thing, and talking about mental health in a far more open way. And one of the sort of transformational things I think we've all seen is the way in which now we are destigmatizing mental health, that we're talking about, and other panelists have already referenced this. We're now talking about mental health with the same degree of prominence and relevance as we are our physical health. You know, indeed, you know, we talk about sort of, you know, health and safety, of course, Paul was saying, used to be very much just focused on the physical side, but as the stats show, and as all the figures show, as all of the absence figures show, you know, we know that over 50% of all absences from any workplace are actually a non-physical thing, and is some sort of mental health or behavioural thing. So overall, the landscape has changed quite dramatically, which is a positive thing. We're very much talking about mental health in the open. And in terms of the question, what is the state of mental health in sort of local authorities in the construction industry? Of course, you know, nobody needs to be told that we are going through unprecedented and dramatic times. Not only did we have the world-changing pandemic, and of course we are still all dealing with the impact and the effects of that, but now we've come straight out of the pandemic, even though the effects of it are still very much with us, into a whole new crisis in terms of the cost of living crisis and the squeeze on everybody's income, on everybody's financial well-being. So there is now a sort of an accumulation of pressures on everybody, on all of society, and of course that's affecting employers in all sectors. So, you know, we'll talk more about this in the rest of the webinar, but it's so important now that we have the support mechanisms in place, so that, for example, the 24/7 counselling helpline, but also I think other people are going to talk about that we are proactive, that we communicate, that we reach out to people, and some of our population, some of our stakeholders are really hard to get through to, so that we are effective in kind of being proactive and relevant and really breaking through and really destigmatizing mental health and saying, look, it's something we all have, it's very real and it's very important.
Thanks, Stephen. Lisa, I'd like you work directly at a local authority, so I'd really like to hear how that resonates with you and the experience in local authorities. And perhaps you could sort of introduce a little bit about the commercial arm that you work for, LCP. And then also I'd be interested in moving the conversation on slightly to talk about specifically procurement and the way that impacts on the issues of mental health.
Yeah, hi everyone. So great opportunity to be here with this fabulous group of speakers today. So thanks to everybody for that opportunity. So I'm Lisa Bliss. I'm the commercial business partner. I currently work for Haringey Council. The LCP is what we call like a virtual organisation that is hosted by the London Borough of Haringey. And what we do is provide procurement platforms for people in the construction industry to procure their works, goods and services for all of their construction related needs. So I'm here with kind of two hats on today. I'm here to obviously, because I'm particularly keen to understand how we can support through procurement and what we provide in terms of our frameworks and our dynamic purchasing systems, by ways of supporting both our commissioning teams and our contractors in terms of supporting people with mental health and making sure that's really prominent in our procurement processes. But yes, I have worked for a local authority for a number of years, and I have seen some changes in the way that well, the stigma around working for a local authority has been over a number of years, that actually we don't do as much as private sector do, you know, and you know, one of the frustrations for me is that that actually really isn't the case. You know, if we look at local authorities at the moment, we are unprecedented times in terms of the budget cuts. So you often find that lots of officers within local authorities are having to do probably far more work than they have had to do previously, and that has seen an increase in what I would say mental health issues, anxiety and stresses at work. You know, we are fortunate, I would say, in terms of public sector, that we do have access to employee assistance programs, but you know, we need to be doing more in terms of making sure that our staff and officers are actually accessing those support mechanisms that are there and available for them.
Thanks, Lisa. And then specifically on procurement, I mean, how do you feel that procurement processes might be generating some of the issues that lead to people taking their own lives, or at very least feeling depression and anxiety?
Yeah, I suppose, I mean, you know, I'm going to just speak from the heart on this session today, and that's, you know, that's what I do. Procurement, you know, first and foremost, we're all understaffed, you know, even if we look at our teams in local authorities, a lot of them are doing it with reduced numbers of staff. And that creates pressures in itself. You know, there's a huge political pressure to get more, house buildings up, from a political aspect. And what does that do? That creates pressure on staff to actually run their procurements. Are we given enough time in our procurements for contractors to actually respond to tenders? Probably not. So all we're doing from a buying perspective is putting the pressure onto contractors to be able to meet reduced timescales. And then what we've heard from our colleagues today is that pressure then comes down in further and further into the supply chain, and then to those that are working on the ground and actually delivering the jobs. So, you know, I think we do have a really important role to play, and that's one of the things I'm really, really keen to hear about today, and why I wanted to approach this subject, is to see what can we do better from a procurement perspective in terms of making sure that our programs are realistic, making sure that we're giving contractors adequate time to be able to respond to tenders, and actually the support they need to deliver the programs, and how that filters through. So, I don't think we're doing it right at the moment. I think there's a lot of work that we can do going forward, but this is, for me, a real starting point.
I'm going to ask the rest of the panel to reflect on that in a second, but first, just back to you, Lisa. It's not all one-sided, is it? Because there's also pressure on the local authority, on the people that are making the procurement requests, to deliver from their end. As you mentioned, that budgets are being squeezed tighter than ever, and there's huge pressure to deliver an awful lot for less.
Absolutely, yeah. So sorry, Toby. Yeah, absolutely. The pressure to actually deliver more for less within the reduced budgets that we've got, that naturally puts a squeeze on what we're asking contractors to provide in terms of their cost, in terms of responses to tenders. We're going to talk about this a little bit more in terms of the social value and how that kind of has played a big part, and what I would say almost a little bit more of additional pressure on contractors. It's a great thing that we need to be doing, but we need to be working more collaboratively. That partnership approach between us as buying organisations and our contractors, and having that kind of relationship where we can support. But it is, if we look at like I say in my first opening statement, you've got officers having to do 2-3 jobs. We don't have the staff that we used to have, and in terms of resources, unfortunately.
Thanks, Lisa. So what advice can you provide here, Sarah? And where do you see the sort of balance of responsibilities falling here? Because there's pressure at both ends.
You're absolutely right. There is pressure at both ends, and I wholeheartedly agree with what Lisa was saying around, the procurement process is very often focused around, getting the deadlines, getting the finances down to the lowest common denominator. What we would certainly like to see is that there is some kind of mandatory section on there which actually asks about mental health, mental health provision within an organisation, and we're not just talking about the tick box, yes, we have a policy, but actually how does it live and breathe within an organization? How are people going to be judged and marked against that? Health and safety will form a really key part of that, but why isn't well-being? And we know that this is an industry where we have got people who are suffering mental health challenges, so we should be providing that link to actually proactively asking what are people doing about it, and having that responsibility for those who are going to be working on the successful bid.
What about Paul's earlier point about collecting data? I mean, that's a really difficult thing to do. Can you explain some of the difficulties there, and perhaps are there any ways forward there?
Yeah, you're right. I mean, things like the the data, as Paul said earlier, it isn't marked within any of the common data capture, but certainly what we see are things like, when we're starting work with an organisation, for example, they'll say, we don't have a problem, we don't have anybody contacting our EAP, everything's great. Well, we have to ask, why aren't people contacting their EAP? A lot of it has to do with stigma, a fear of breaking confidentiality, a worry that this is actually going to be career limiting if someone speaks up and says that they need some support or help. 40% of people in our SME survey, for example, said that they wouldn't dare talk to a line manager or the person responsible for the job about their mental health. We have to break this down and make it an environment where people are looking for the signs and what to look for amongst people who are working to your right, left, in front and behind you, but also one where, yes, data and statistics are important, but it's more the story behind it. We can always turn data and stats into however we want it to be, but more importantly, how is the culture of an organization and what are they proactively doing around it?
Thanks, Sarah. Lisa, I know you want to come in. I'm going to come to you in just a second, but first, Paul, I just want to put that Sarah's point to you, which is around a mandatory section in procurement to ask what mental health provisions are being made. Would you welcome that at Lend-Lease, and welcome your thoughts on other threads as well?
Yeah, absolutely. Interestingly, it is something we're looking at the moment. So, as Sarah said, we measure supply chain, all sorts of things. It tends to be around things like financial figures and health and safety stats, and all that sort of important stuff. But historically, certainly, we haven't really asked about what their approach to mental health and wellbeing is. We are looking at that. I know for a fact that because very occasionally I get involved with bids as well. I know often as part of the bid process now, you're often asked about your approach to mental health and wellbeing. So I think it is changing. But Sarah makes some excellent points there around, the issues amongst suppliers. And I'm not personally that close to our procurement strategy, so I don't really get too involved in that. But I know it's very complex, right? In construction, it's incredibly complex. It's very complicated. I know, for example, the significant number of people that are working and working on our projects. That they might be walking around with a big sort of high-vis jacket with a big name on the back of it, but often they don't work for that company. They're very often self-employed. There's an awful lot of subcontracting goes on in construction. Getting to the people at the coalface is incredibly challenging. And to Sarah's point about the fact that she's heard stories where people are sort of actively discouraged or don't feel they can talk openly about their mental health and well-being. We find that often. We find that we're trying to do all sorts of great stuff, and either there is a perceived discouragement or an actual discouragement to engage with it, and that's really, really challenging. Another challenge, of course, that we find is we can bring in initiatives on our projects where we can directly influence it. A very simple example might be something, for example, around working hours. We know fatigue has a massive impact on mental health and well-being. But if you bear in mind, an awful lot of people in construction are paid by the hour, or if we start saying, right, you can work so many hours on our project, all they're going to do is go and work on another project somewhere where they can either earn more money or they'll do the overtime. So it's a very, very complex thing. And, we can directly impact our own people. We can do an awful lot of great work, and we do in that space. It's far, far more challenging working with our supply chain. We are engaging on several different fronts at the moment. We are doing an awful lot of training at the moment with supply chain, where we're offering free places on different training programs that we've got. As I mentioned before, we work quite closely with the Lighthouse Club. We're bringing them into some of our projects to do some stuff there as well. But it's tough. It is tough. And somebody once described it as like a sort of a great big kind of cruise ship or oil tanker. You're not going to turn this thing around very quickly. It's a very, very gradual turn. It's significantly better. I think the industry is in a far better place than it was a year ago, 5 years ago, 10 years ago. But my gosh, we've still got an awful lot of work to do.
Long way to go. Lisa, you wanted to come in earlier. We were talking about data gathering, I think.
Yeah, my point, obviously data gathering is really, really crucial, but the bit that really resonated with me, Toby, that I wanted to touch on in terms of what Sarah was discussing was the real kind of stigma and people's concerns around potentially the loss of jobs and loss of work if they actually come forward. You know, from a local authority perspective, I certainly see that. You know, we know that there are budget cuts. We know that, you know, we are constantly going through restructure after restructure. You know, back in the day, there was always the feeling that, you know, if you were sent to go and speak to somebody about any health issues, that you would then be you know, you're on your way out the door, you know, typically. And I think we've really got to do a lot of work to try and address that kind of stigma around reaching out and being able to talk to people, because I do think, you know, women are more likely to talk. You know, look at me, I don't typically shut up, but you know, that is one of the things, you know. So if we look at the numbers, and I think it was a stat that Sarah mentioned previously when we spoke, was that actually women are suffering from the same type of mental health and issues, but they are more likely to reach out and have that conversation, whereas men typically don't. And I think that, again, is something that we really need to start addressing, is basically giving the men in the workforce the, you know, the confidence that it doesn't mean that they're actually going to, you know, lose a job, or they're not manly enough, because they're actually, you know, reaching out and having open conversations. And it was just a point that Sarah touched on that I wanted to really emphasise.
Yeah, no, fair enough. We're going to come to you in a second, Stephen, and we've got some great questions coming in from the viewers as well. But Paul, you wanted to come in.
Yeah, so just very quickly to the bit about sort of speaking to EAPs and such like, you know, I completely agree with both what Sarah and Lisa have said. You know, there is certainly historically a reluctance, and as a business, as an organisation, you know, the usage levels of our EAP and private healthcare were very low from a mental health and wellbeing perspective. Over the last year or two, though, we've seen a significant uptick in terms of the number of people accessing both our EAP and our private healthcare insurance. What we've seen, very interestingly, is that we've seen an increase in the amount of absence taken related to mental health in terms of reported, but we've seen a decrease in the amount of time people are taking off. So what we've seen is we've gone down from an average 28 days taken off from mental health related issue to 15 days. So what we're seeing is we're seeing more people come forward because the culture allows them to. Okay, we're seeing more people honestly, you know, disclosing why they're having time off work. But what we're seeing is a significant decrease in the amount of time that people are having off. These people were having time off before, they just weren't disclosing it. You know, they were saying something like, you know, I've got the flu or I've got a cold or whatever. They were still poorly. They were still taking time off. They just weren't being honest about it. So this, no one ever comes and speaks to our EAP, isn't a good thing. You want people. And we are really glad now that we're seeing some real open reporting around time off, but more importantly, that we've almost halved the average time off now that our staff are taking for a mental health related condition.
That is absolutely fascinating and very telling, Paul. Thanks very much. Stephen, you've been waiting really patiently. I'd be really interested in your reflections on what we've heard so far, and also in sort of moving forward to talk about some of the strategies and initiatives that you can demonstrate have improved mental health and that viewers can take away from the session today.
Yeah, Toby, thank you. Yeah, just to sort of comment on the sort of uptake and utilisation of sort of EAP services. Again, very conscious, you know, we're using sort of jargon, you know, EAP, Employee Assistance Program, or sort of translated as a kind of a confidential counselling helpline. One of the things I think always to really to emphasise is that these services are genuinely and completely confidential and anonymous. Of course, you know, we provide and providers of this service do provide statistical analysis back to employers in terms of how many people have accessed the service, and also a really sort of interesting and informative analysis of what the main reasons and what the different trends are and why people are accessing a service. But in all of our communications to employees, it's so important to emphasize the confidentiality and the anonymity of these services. Also, it's important to emphasize that those EAPs, by definition, and we've spoken about this, are kind of reactive services. They're there to support employees and family members. We should always remember that. But there are so many things, proactive things, that employers can and are doing in terms of newsletters, in terms of webinars, in terms of mental health ambassador programs, a whole range of initiatives to really kind of to give life to awareness of of mental health. And so we are seeing more and more organizations, for example, having a tangible example is having a mental health calendar to tie in with a whole range of other themes and things that are going on throughout the year. So each month there is an emphasis on mental health, be it mental health to do with financial well-being, or mental health to do maybe with cyberbullying, or whatever it is, mental health and sort of pride issues, for example. There's a whole range of things we can look at and sort of connect with what's going on in wider society. So what we say to our employers and what we to our customers and what we enable them to do is to have a rolling, proactive mental health strategy. The other thing I would comment upon and add to as well, that in terms of procurement, in terms of tenders, in terms of specifications, absolutely to give the same weight, and this has already been said, to mental health support and mental health provision, to actually our physical health and safety, to actually say that it is a demonstrable requirement that people need to, employers, that contractors need to say what they're doing tangibly to support the mental health of their teams.
And there's something, isn't there, about the complexity of the workplaces and the work environments in which you're introducing these programs and policies. You memorably said when we were talking earlier in preparing for this session that you can't put up a poster on a building site saying call this number for help, but not if you work for a different company. And how do you advise businesses to look at the sort of complexity of their environments?
Yeah, I mean that is a real and practical challenge. And just to sort of break that down a little bit, just to explain to everybody what would sort of normally happen, that each company, large or small, would typically take out their own employee assistance program, and obviously there are many other providers, not just us, who provide this, dozens of people who provide this. So potentially you have a situation where everybody on a site is maybe covered by a different helpline that their employer may or may not have put in place. The problem there is that can be really very confusing. Would we have a situation where there were 15 different posters put up to say, if you work here, here's the number you should call? And then what about all the self-employed people? What about all of the really small contractors? So what I think we need to do is actually organize in terms of the communication on a sort of per project or a per site basis. And that means a lot of collaboration between, really, I would say, all of the sort of the major contractors involved in one particular project to say, look, this is let's call it the mental health helpline or the counselling helpline number for this project and for this site. So that would be a new way of thinking about it, but that would be a really practical way of actually providing that lifeline of support to everybody who's there on site.
Thanks, Stephen. Paul, interested in your reflections on the complexity of your working environments as well. And we were talking previously about the number of languages that are spoken, for example.
Yeah, sure. So look, everything Stephen said there resonates massively with our projects. You know, we have loads of different organisations on our project at any given time. It would be impossible to identify all of their different EAPs. And we're also very mindful of the fact that, you know, if we put too much of our own stuff around site, it's like, well, it's okay for you guys, you've got all this stuff, what do we get, kind of thing, you know. So we have to be a bit kind of cautious, I suppose. I guess one of the reasons we work so closely with the Lighthouse Club is because of their role in this kind of EAP space, for want of a better way to describe it. You know, they are a charity focused very much on providing EAP support to those individuals that haven't got EAP support. And you know, it isn't just about necessarily mental health, it's about finances and legal issues, employment, all sorts of wonderful stuff. So we do tend to sort of focus quite heavily on that organisation on our particular sites. But to your point about things like languages and that kind of stuff, you know, we have lots and lots of different languages spoken on our projects as well. And this can conjure up all sorts of issues, you know, outside of the mental health and wellbeing space. But one thing we're trying to do is things like, you know, simple translations of materials, for example. We ran a recent campaign called #Talking is our greatest tool, which we had translated into, I think, 4 or 5 of the most commonly spoken languages on site. We also have quite a large Italian business, so we've had a lot of our materials translated into Italian as well. I was fortunate enough to go over to Milan a few weeks ago to deliver some training and other bits and bobs out there as well. So yeah, it's not easy. There's an awful lot of stuff going on out there, but with it, you know, with the right kind of will and a bit of sort of methodical approach to it, it's doable. It's doable. But to my earlier point about it being a very slow burner it is. I don't think we can expect to kind of do something one day and wake up the following morning and for everything to be well with the world. And if I just sort of put my health and safety manager's hat on for a moment or two, and I think about the journey we've been on with health and safety over the last 20 or 30 years, we're in a far, far different place to where we were 30 years ago. But it's taken an awful lot of hard work and effort to get to the point where we are now. These things take time.
Thanks, Paul. And we're hearing from Kerry Tonk, who's working at Wolverhampton Football Club, that they've seen a 60% increase in employees accessing EAP since they trained staff in awareness. So just echoing your reflections already. We've also got some questions in from David Rowbottom, Les Carter and Sandra Roebuck. I think the most useful way of responding to those questions, and they seem to all be on the same sort of area, is actually, what practical steps can organisations take to improve mental health? There's a very specific question about large companies who are contracting with smaller and medium-sized companies from Sandra, and we can come back to you, Paul, if you've got anything to add to that. But Sarah, do you want to pick up on this aspect of the practical steps? What would you advise organisations to be doing?
Yeah, I mean, it's really great to see about the Wolverhampton Football Club, and that absolutely echoes, what we see when we start working with organisations as well. Balfour, for example, of same as Lend-Lease, have really seen an uptake in, all their support that's available to their teams. So not just the phone lines, but also, other aspects of their well-being aspects as well. I think it's very much around that. Encouraging open conversations and allowing people that permission to not have to solve whatever that conversation might lead to. We're in a very practical industry with some tremendous people working on huge problem complex solutions. But just having a conversation doesn't mean that you have to come up with a whole raft of, solutions to meet that person's particular challenge. You just have to listen. You have to listen non-judgmentally and ask them twice if they're okay. Don't be fobbed off with the "I'm fine." We all do it. But actually, if you are seeing changes in behaviour, if you are seeing somebody becoming perhaps withdrawn, procrastinating, you saw the video at the beginning with Chris, there were very definite signs that he was starting to go into a crisis situation. It happened very, very quickly. And therefore, it's crucial that we just look up and out away from our screens and start having conversations with people. That the line managers, because very often people will talk to their colleagues, they talk to their friends, talk to their family, but they won't necessarily talk to the person who can make a difference. And therefore, equipping the line managers with that next level up conversation, and that's where mates will have that manage the conversation training available, is making sure that it's done in collaboration. So somebody is expressing that they're having a challenge at the moment. You work together on what that solution might be, and you're not disempowering them or sending them off sick, because very often sending somebody off sick can be a real trigger to heightened anxiety, heightened worry, because they worry, what they're being replaced with, what people might be saying, how they're being perceived. But do it in collaboration. And changing that culture and supporting it in a very open way will very often make that difference.
Thanks, Sarah. And I'm just going to reiterate one of the points you made there. I was speaking to a friend fairly recently who said that they'd said hello to someone, a colleague, and asked, "How are you?" and was told fine, and said, "No, how are you?" And he said, "I got more than I'd bargained for." But if he hadn't asked that second time, he wouldn't have known the depth of the anxiety and problems that his colleague was facing. And it really is a soft skill, as simple as that organisations need to engender.
You're absolutely right, and the mental health first aiders and is great, but the chance of having a mental health first aider talking to somebody at that right time, right place, it needs to become everybody's business. It needs to become across the whole workforce, regardless of whether you're working in the office, whether you're working behind the canteen. I was at a site on Monday, and the person who was serving the lunches expressed concern to the person I was with, saying, I'm really worried about this person. You know, they've changed in their behavior. They are aware of somebody who's coming every day to get their breakfast, to go and sit on a table, and they were expressing concern. And that is, you know, exactly what we should be seeing, that it is everybody's business, to be concerned, to be worried, but just to be vigilant and be caring.
Thanks, Sarah. And Paul, I just want to come back to you on, because it's everybody's business. And how do you ensure something like this is employee-led rather than kind of imposed from above? How do you get that kind of cultural change in an organisation?
Yeah, I think the key is for it to be employee-led. I mean, when we sort of first started on our journey, you know, all those years ago, it was sponsored by a senior member of staff, but the kind of working group, for want of a better way to describe it, the people that came up with the ideas at the time were employees, basically, and employees who were incredibly passionate about it and drove it forward. You know, in my career, I've been involved in many different sort of initiatives, programs, behavioural safety stuff, you know, loads of different things over the years, but I can honestly say I don't think I've been involved with anything quite as impactful as what we're doing in this particular space. And I think it's because it's kind of been sort of almost kind of like chugging along in the background. You know, there haven't been any kind of like big marching bands and, you know, and flag waving and all that kind of stuff. It's just been happening and being driven by really, really passionate people. I think key to it has also been our strategy around mental health first aid and training cohorts of people in that particular area, because they very much act as champions. They're very much the people who are out and about. And Sarah's absolutely right. There's no guarantee that, you know, there's always going to be an MHFA available. But the more we educate people, I believe, and the more we get those conversations going, enabling those conversations, the easier it becomes. And, you know, one of the things that I've been asked many times over the years, you know, what's your single big tip? You know, what would you do to change everything? And as Sarah said, it's not rocket science. It's just encouraging open and honest conversation. You know, the more we encourage people to be able to talk openly about how they're feeling, the more we destigmatize it and the more we encourage conversations. And, you know, you kind of end up in this point where you normalize the conversations around mental health. And that's kind of where we want to be. I don't believe, you know, the industry certainly isn't there yet. And I wouldn't sort of sit here and say that Lendlease are quite there yet, but we're in a far better place than we were. Yes, it's great. You know, it's lovely if you've got lots of money to throw at these things as well. And, you know, and initiatives and resource, of course, that's important as well. But even for sort of, you know, very small organizations where they don't have all that stuff, just get the conversation going. That's all it's about. Get people talking about this. There's no kind of dark art to this. It's very, very simple, I believe.
Thanks, Paul. Stephen, would you advise construction companies differently from your advice to local authorities in terms of steps to take and sort of practical ways forward on this?
I suppose the emphasis, the advice that we would give, I suppose, different to construction companies is to be mindful that a great percentage of the workforce are not going to be office-based. Then people are not going to be sitting sort of 9 to 5 in front of a laptop, in front of a screen. And therefore, some of the ways of communicating with a more sort of disparate workforce, people who are out and about in the field, on site, is a little more challenging. So we've got to look at different ways of actually sort of getting that communication out. And actually physically, on-site posters, some leaflets, cards, wallet cards, even things like sort of fridges, magnets for fridges, things like that. Communication also that people can actually take home or sometimes even post it to people's home address. And so it's about physical, practical ways to reach out and to remind people of what support and what infrastructure there is. One of the sort of challenges we've got is we all like to sort of now go digital and rely on all of our sort of digital communication. We've got to understand that a lot of people simply don't engage and won't engage and don't sit in front of, you know, probably all of us do here, don't sit in front of a computer all day, every day. And that's the real challenge, to actually reach out to people. Getting the messaging is right. What Paul was saying, what everyone was saying about making it tangible and real, normalizing the conversation about mental health, saying that mental health is exactly the same as our physical health, but actually breaking through and actually finding some of the old traditional ways of communicating to people that aren't simply a reliance on digital communication.
Thanks, Stephen, and thanks for your comment, Claire Bullen, supporting what Sarah and Paul were saying earlier. Lisa, we're coming to the moment of summing up. I'd be really interested to know what you've picked up from from today, what you see the role of frameworks being, and what LCP might be actually doing as a result of our session and what you've learnt here.
Well, I mean, I'm sure everyone could agree. We've had some really great things that are going on already in the industry. But as I touched on, from a procurement perspective, there's definitely more that we can be doing. You know, one of the things, just from a framework perspective, so our framework is going to be up for renewal soon. You know, we have a set of KPIs. We look at the standard, how many, you know, health and safety incidents have, you know, had on site. How many of those are actually attributed to actually as a result of somebody who was suffering with mental health? We don't capture that data. I think there is an onus on us as a framework to make sure that we're actually building those type of data collection around mental health into those key performance indicators as well, and actually being able to then provide support to the contractors that are on our framework to make sure that they've got things like employee assistance programs and things like that, and also that the work that our tier 1 contractors are doing is really then supporting their SMEs and their supply chain, and I think we can play a real part in that. I think additionally to that, and it's something that I've been really thinking about, is the onboarding process onto our frameworks, right at the very, very crux of the procurement, like, you know, at the start when we're really starting to engage with contractors, making sure that we are working with contractors who are already in the forefront of driving the kind of mental health agenda. So actually building something into the SQ, perhaps, you know, we do have flexibility as purchasing bodies to add additional questions into the part 3 of the SQ, for example. So why would we not look to start introducing some tangible questions where we can really get into the nuts and bolts of what organisations are actually doing to support their workforce? You know, touching on the video right at the beginning, I did have to turn my screen off because it did emotionally really like hit me hard. And if anything, that has made me more determined to make sure that the LCP is driving this going forward. So thank you to everybody today.
Thanks, Lisa. Paul, how do you reflect on as a contractor on those steps that a framework might be taking, and what frameworks can do generally? And also, I'm going to add a second question, which is there's a point made by James Hunt, a viewer, about a recent Daily Mail article. I don't know if you saw it, but perhaps you'd like to reflect on the helpfulness or otherwise of that.
Well, probably not surprising for those of you that read it. I'm not particularly sort of I don't know, and enamored by their mindset and thinking around. In essence, what it basically said was that construction's going woke. Construction's going woke because now construction workers can think they can talk about stuff, and they're no longer eating 74 sausages and 53 rashers of bacon every morning for their breakfast, and now eating muesli and fruit, you know, bizarrely. Incredibly damaging, incredibly disappointing article. Probably not to be surprised, though, coming from that particular publication, but there you go. Back to your other point about sort of procurement and such like. Yeah, look, I think anything that we can put in place that raises this issue up the agenda, that gets organisations thinking about it, has got to be a good thing. You know, and again, I reflect back on my journey in health and safety. You know, 20, 30 years ago, health and safety, what's health and safety? You know, why are we doing all this stuff? You know, we now recognise the value it brings. I hope in another 20 or 30 years, hopefully sooner, you know, we'll have the same attitude towards mental health and well-being. You know, we'll look back and at these times and be kind of thinking, my gosh, I can't believe what we used to do back in the day. You know, I can't believe what we used to tolerate back in the day, and reflect on it that, you know, things are far better than they are. But I think anything we can do, even if it's something really, really small, has got to be a good thing.
Thanks, Paul. And I know you're not directly involved in procurement, so appreciate your insights from the health and safety point of view. Stephen, last words from you?
Yeah, it's really just about making it real. The challenge always is to sort of to really sort of resonate with people's lives, to communicate in a way that is sort of that is practical, that meaningful, to find those ways of communicating to people who aren't in front of a screen. And as everyone has said, it's to sort of to destigmatize, to normalize the conversation. I mean, I think actually, you know, in some ways we should all be, you know, mindful that we've made a massive amount of progress in the years that I've been involved in this. The conversation has come on leaps and bounds, and that's really, really positive. So we must all acknowledge that. But clearly there's a long way still to go. We've got to eventually end up, as Paul just said, with a situation where mental health is considered right up there, the same level of importance as physical health, be it health and safety or our own personal sort of well-being. So, you know, with all stakeholders committed to this, I think we're on a journey of really improving dramatically the mental health landscape in this country.
Thanks, Stephen. And we've got a number from the audience who've agreed to help collaborate on initiatives going forward, Lisa. So we'll make sure that they're in touch with you so that they can inform your policies going forward. We started with Mates in Mind. We should finish with Mates in Mind. Sarah, how do you reflect on the conversation today and on the sort of next steps that Lisa and the industry need to take?
Yeah, very. I think it's been a great conversation. There's clearly some really lovely pieces of work going on as well, and having some great impact there. For anybody who hasn't started that journey, absolutely, Mates in Mind can support, particularly if the procurement changes do start coming about, and you feel that perhaps you need some additional support in this space. We're very happy to have that conversation. But one other final bit is, don't forget your apprentices. These are people who have lost the last 2 years of their education. They're coming onto a site. This is a very culturally different environment for them. Make sure that they're also included in what's going on. We are seeing, from our work with colleges, we are seeing that this has impacted them, and they really want to feel part of the workforce and part of, the changes that are happening. So as important as the supply chain and the sole traders are, as well as your employees, please don't forget these, the young people who are going to be the line managers, business owners, and are going to carry on this career for a long time to come.
That's a great point, Sarah. And it's the last point. Viewers, please join me in thanking our brilliant panel for sparing their valuable time to share their knowledge and experience and insights today. So thank you to Paul Hay from Lend-Lease. Thank you to Sarah Meek from Mates in Mind. Thank you to Stephen Stanbury from Wellbeing Solutions. And thank you, Lisa Bliss from the London Construction Programme, both for your contribution to the conversation and for your sponsorship of the event today. And we'll look forward to discovering how you take some of the thinking from today forward to make LCP the framework of choice for organisations who want to see procurement support well-being. And viewers, we hope you've taken some practical steps away from the session today as well. Thank you for tuning in and for gracing us with your attention and fueling the conversation with your stimulating questions. I didn't answer any of them directly, but I hope I tried to answer as many of them as possible indirectly, or put them indirectly to the panel. Any that are left hanging, I will be putting them to the panel, and we'll be posting responses from them onto our LinkedIn Members Club over the coming days to keep this conversation going. Now, we've got a set of 3 interviews to bring you over the next month, viewers, starting with Mark Bagent, Corporate Director of Regeneration and Culture at the London Borough of Redbridge on July the 5th. And then we have Councillor Kieran Williams, the leader of London Borough of Southwark, and Stephen MacDonald, the Director for Growth at London Borough of Barnet, all over July. So join us for any or all of those wide-ranging discussions of growth and development and the organisational personal challenges faced by top council decision makers. Details for those are going into the chat now. But until then, from our fabulous panel, from me and from the London Construction Programme and from everyone at 3 Fox, thanks and good afternoon.